All right, we are back, Senate Health and Welfare and March 30th. And we're going to take some testimony on H 655. And we have the bill up under Jen's name as passed by House. That's the bill we're looking at. And then we've got our witnesses. So thank you, witnesses, for being here. Going to look at my agenda so we stay in order. So Lauren Hibbert is here, and is this order that makes sense to you? I know that you folks have probably worked together in the House as well, but Lauren, why don't you just go ahead and we'll listen.
Okay. Good morning. For the record, Lauren Hibbert, Director of the Office of Professional Regulation. I do think this order works well, although I was able to speak to this committee at your last hearing on this bill. I don't have a lot additional to add to the conversation than what I testified to at your last hearing. I'm certainly happy to answer any questions about the bill. And I just want to reemphasize to the committee and to folks who may be watching that this bill is the OPR priority for this year. It builds on work that we did with the Act 21 stakeholder group related to telehealth. You have some of the stakeholders here, the two here worked tirelessly on this issue with OPR over the fall and summer, but there were a significant number of others who participated in the conversation, a very diverse group of people, everything from providers of healthcare to healthcare institutions, we heard from advocacy groups, we heard from the college system. So it was a very, and the insurance community, which of course, Rebecca Copens is here representing, but it was a very robust conversation. And this bill represents the recommendation that working group made. And I think it will set up Vermont in a very structured way, a nuanced and structured way to provide telehealth for the future. I think particularly items of strength are that professions can do rulemaking specific to their profession-specific needs around telehealth. And it also is fairly broad in terms of how professions can set up their requirements for a telehealth license, all through rulemaking, which of course has legislative approval. I also think it's important that we have two different levels of telehealth, the Telehealth Registration, which is limited to 10 patients, and the Telehealth License, which is limited to 20. I think this gives the state appropriate oversight over telehealth activity. And I firmly believe that the state needs more oversight over telehealth. This committee heard me say last time, but telehealth is healthcare. It's the same. And harm can happen in a telehealth environment, just like it could in an office environment. Greatness can happen in a telehealth environment, just like it can in an office environment. People are really being helped through telehealth. I'm sure that you all have heard feedback from your constituents on this. I've heard from so many patients pleading to continue a structure where people can provide telehealth because of the assistance they've received. We also have received complaints about telehealth. I think we're now up to 7 complaints about telehealth. So there's a tension there, and I think this bill navigates that tension well, and is why the OPR is so supportive of this bill. We're really looking forward to the work that's going to need to happen with this bill, the rulemaking, the structure. I just wanted to add that we do have an appropriation in this bill of $360,000. That is to help us set up the program before we receive any fees. This bill would go into effect in July and allow us to start doing rulemaking, but we would not open the telehealth registration or the telehealth license until July 1st of 2023. So we have some setup work to do, and that $360,000 is intended to help us support doing that work.
So, and yeah, go ahead.
I think that was all I was going to say, and I'm happy to answer questions.
Okay, so I'm looking at the fiscal note. We do have it on our webpage. We have not yet been through it with Nolan, and we will do that. But my question of you is, we're looking at, going into the red with this, but after the program is initiated, would that red turn to black?
The honest answer, Senator Lyons, is we don't know. Okay. And we'll have to reassess it. We don't know how many providers we're going to gain through telehealth, and we don't know how many providers we're going to lose through telehealth. So right now, anyone who's providing care, well, not right now, previous to COVID, before somebody could provide telehealth to a Vermonter, they needed a Vermont license. Clearly, the whole world has shifted. A license is not required right now and has not been since, Act 91 was enacted. And the fabric of healthcare has really changed. Telehealth's become much more prominent. It's being used significantly by standard brick and mortar institutions, but also by startup companies. I mean, it's just an exploding arena. And something that should have state oversight over it, and also should be allowed to explore. We want to make sure that there's appropriate constraints, but that that innovation can occur in this space. So we just don't know how many telehealth providers we're going to have in the state, and which of the selections they're going to choose, whether they're going to choose a telehealth registration, a telehealth license, or a full license. It's sort of the provider gets to choose. It's the Goldilocks solution, right? So the provider gets to choose the solution that fits best for them based on their provider, how many clients they're going to have and how long they're intending to practice here. And from OPR's perspective, we'll have to take all of the numbers into account when we review our budget every year and review our fees every year, which we do. And the fundamental thing that we want to ensure is that the cost of operationalizing the telehealth program and of overseeing the telehealth program does not fall on in-state licensees. And that's part of the reason why we have this $360,000 appropriation ask, is because if we did not ask for that, we would be using in-state licensees' fees to subsidize and start up this program.
Okay, Senator Terenzini has a question.
Yeah, thank you, Lauren. I think you just answered my question with your last piece, but for example, my primary care doctor, if I wanted to use his services for telemedicine, he's not paying any additional fees for what we're about to do here. This is only if I wanted to see a doctor from Ohio or something, would have to, and then we'd be charging that fee to that practice, but in-state doctors are not going to have to pay more for what we're
That's
about to
correct. That's
Okay.
correct.
And
That's
really,
included. It's part of it's included in their full license. Telehealth is.
Okay. All right. That's
Is
really
one way to look at it.
Yeah, because we know these doctors are now running on razor-thin margins, and they can't incur any more costs in the state.
So I'm going to suggest we move on to Rebecca Copans and then to Jessica Barnard. And then one of our goals today is to go through the bill and have a markup discussion with you folks. So, and we'll bring Jen up into the chair and we can do that. So Rebecca, very briefly, comments on the bill. I know you said there are comments we have from Blue Cross and Blue Shield that include other bills, and I'd like to avoid that right now, but just the 655, please.
And Blue Cross Blue Shield of Vermont. We fully support increasing Vermonters' access to care, particularly mental health and primary care, but as well as to specialists that Vermonters may have limited access to in-state, and creating an avenue to care that balances access with careful patient protections is our primary goal with this legislation. And I want to thank Lauren Hibbert and her staff. They created a process that allowed this issue to be looked at from every angle. And we didn't always agree, but OPR facilitated a process where everyone's concerns were heard, sometimes at length. And universally, the group agreed that mandating provider registration while creating a path for a streamlined approach to licensure is the best way to balance access and protection to Vermonters. So thank you for taking this issue up, and we appreciate your support.
Okay, this is great. I know that as we go through the bill, we're probably going to have questions of you, particularly since we're looking at crossing state lines and you're looking at patient-doctor relationships that cross Blue Cross Blue Shield lines. It'd be helpful to have you share. So Jessa, thank you for being here. Why don't you go right ahead?
Thank you very much for having me. Jessa Barnard, the Executive Director of the Vermont Medical Society. We represent physicians and physician assistants. And just to be clear, the physicians we represent are both MDs and DOs. So the majority of our members are actually licensed by the Board of Medical Practice. And while I know David Hurley, he isn't testifying today, he also participated quite a bit in the stakeholder process. And we've been in touch with him as this bill has moved along. And then DOs who are under the Office of Professional Regulation. And just to echo the thanks of OPR and Lauren and her staff for all of the input they received in this process. It was quite interesting to hear, I come in with my physician hat on, but then there were veterinarians and mental health counselors and pharmacists. And so I think one of the strengths of what 655 creates, and one of the reasons we support it, is leaving a lot to rulemaking that's specific to each profession. Because when a lot of these issues came up, what about prescribing? What about this? What about that? What about mandated disclosures? So much of it will vary based on which specific profession we're talking about. What I might think of for physicians might look totally different for veterinarians. And so we do support, while there are some universal guardrails that the bill includes, that there is also the flexibility for rulemaking to make sure it really is relevant to each profession. I did submit some written testimony, and I won't go over that. It gives some examples of the types of patient care where we see this being most helpful. I do want to just point out, since I know you'll be getting into the details, and mark up a couple of the elements that we think are the most important that are included in 655. So one is that it says, again, one of the universal things for all professions is that professionals will be held to the same standard of care, same scope of practice, and same laws regarding prescribing as in-state health professionals. As Lauren said, we don't see telemedicine. Telemedicine is not a different kind of practice. It is just a different modality of offering the same types of services, and so it should be held to the same standards as any other type of medical care. We think the limits on the number of patients who can be seen without requiring full licensure are very important. That was something the stakeholder group discussed at length. And I know I saw you received some written testimony from another entity asking that be loosened, and we would have concern with that. We think that once your practice, again, regardless of whether you're using telehealth or in-state, once you have enough contact with Vermont patients, you really should be licensed and regulated like any other in-state health professional. So while we want to balance that with the lower fees and the faster processing and flexibility that the registration and telehealth license will offer, we think there need to be some limits on the extent of your practice that should be done that way before you're like any other in-state professional and need a full license. And then we also support the balance in the bills regarding sufficient licensure fees. As Senator Terenzini just brought this up, we want to make sure that while, again, we support this additional flexibility for out-of-state telehealth, or folks providing care via telehealth from out of state, that cost of regulation not be borne by in-state health professionals, and so that those who are going these licensure pathways cover basically the costs of setting up and maintaining that licensure system, and and pursuing any disciplinary cases or regulation and oversight that might be needed down the road. So we know that on the House side, they spent quite a bit of time on the nuances of the fees, and we support the approach that it's taking to make those balances. So thank you very much for taking up the bill. We really support moving the bill forward, and think it is quite innovative, actually, and puts Vermont on the forefront of moving telehealth practice and regulation forward in the country.
It does. I mean, and we've been identified for that, by NCSL in the past for the work that we did on telehealth. So we continue to be leaders, and it's because of people like you that's happening, and we appreciate your work on this. So I'm talking to all three of you when I say that. No, greatly appreciated. So why don't we do this? Unless there are questions for Jessa at this point, or Rebecca, or Lauren, why don't we have Jen come up, and we're going to go through the bill with an eye to mark up suggestions. And I have one, but I don't know if it's necessary or not. We'll see. So why don't we just take the bill, Jen, and you can walk us through slowly and.
Okay,
Here we
good
go.
morning. For the record, Jennifer Carvey, Office of Legislative Counsel.
And let me just say one thing in the beginning. So if you see something that you want to ask about, and I'm talking to the committee, and I'm also talking with folks who can put their hands up on the screen. If there's something you need to interject that will help us, please do that. And we'll just make this a conversational process. So go ahead.
Okay, this is H655, and we're looking at the as passed by House version. This is an act relating to telehealth licensure and registration and to provisional licensure for professions regulated by the Office of Professional Regulation. Section 1 adds a new chapter in Title 26, which is where we regulate professions and occupations. A new chapter 56 on telehealth licensure and registration for out-of-state healthcare professionals. And first it talks about the scope, that the chapter would apply to certain healthcare professions regulated by OPR, and then it lists a number of healthcare professions. We did not go through the list before. I don't know if you want to go through the list now, or if you're all just looking at the
Well, why
list.
don't we just, as we go, we'll all scan through it and we
Great.
see if there's anything missing.
And then in subsection B, it applies to certain healthcare professions regulated by the Board of Medical Practice.
And these are all, this is basically, there's not anything new here. These are ones that are already regulated through OPR.
These are already regulated by, right, these are already professions that are regulated by OPR or the Board of Medical Practice. It's just talking about the chapter on telehealth licensure and registration applying only to these listed professions. So there are a few others, for example, I believe OPR, not OPR, Board of Medical Practice regulates anesthesiologist assistants. That was one that was not identified as necessarily appropriate for telehealth, so they're not on the list.
That would be hard to do via telehealth.
Exactly. So
I think there are some people who would put me to sleep.
there are most of the professions that are regulated by OPR and the Board of Medical Practice, or at least most of the healthcare professions regulated by OPR, and most of the professions regulated by the Board of Medical Practice, but not exclusively.
Question, I see psychology there. Does that include mental health counselors?
There are many different types of, so I believe, and I will.
It says
let
social
Lauren-
work.
Right, so if you look at number 2, that's allied mental health professions, including mental health counseling, so
I didn't even
that falls under a different,
glazed over. Okay, good,
Right.
thank you.
different provider type.
Good, thank you.
Yes, and these are in alphabetical order for lack of any
Okay.
better order treatment.
Okay.
Section 3052 has definitions. Some of these are fairly straightforward, but some of them are pretty specific to this chapter. So board is the Board of Medical Practice. A healthcare professional is someone who holds a valid license, certificate, or registration to provide healthcare services in any other U.S. jurisdiction in one of those healthcare professions. So this relies in part on somebody's out of state or outside of Vermont license, certificate, or registration, because as was discussed, if they're licensed in Vermont, then they don't need to go through this process. Their license already includes telehealth. Is that a question?
Just a question on the licensing and the regulations for licensing in other states. Do they have to be the same as the requirements in Vermont in order for them to be licensed here?
No, they need to hold a valid license, certificate, or registration. They need to provide verification of that. I don't know how much you may want to ask Lauren what they would do to verify or look at what the licensing process is in other states.
So they'd have to send like a scanned document of their license, or how does that work, Lauren?
Sorry, I had to get myself off of mute. We will receive a verification of license from the other state. So that'll be part of the process when they apply. And that's a piece of this bill that I should have talked about in the intro with provisional licenses. We will issue a provisional license while we're waiting for that verification so that they'll be able to start practicing. But then we will also receive official verification from the state where they are licensed, and they should be licensed in the same area. If you're a mental health counselor in Connecticut, you would show verification of being a mental health counselor in Connecticut, and we would allow you to practice here on the basis of that verification.
But as far as what the requirements are for becoming a mental health counselor in Connecticut, they don't have to be the same as?
They don't have to be exactly the same. I think we'll be looking more at scope of practice, what your scope of practice is. And regardless, you will need to follow Vermont's scope of practice.
Okay.
But there are, this is an area that we may do some rulemaking around. There are professions where there's wide diversity in what a naturopath can do. In some states, naturopaths can do a lot of things, like our state, and in other states, naturopaths can do a very narrow window of things. So we just want to make sure that we're not exposing, we may have higher standards to become a naturopath in Vermont, additional requirements that give the state the security, peace of mind that they're able to practice at the scope that they are practicing at. That may not be required in another state. So we wouldn't want that person to come here and practice at the Vermont scope because they didn't meet they wouldn't meet the qualifications for a Vermont naturopath. So that's an area that we may need to do some rulemaking around, understanding that there are differences in scopes of practice in some of the professions that OPR regulates. And I do think that's more of an OPR nuance than a Board of Medical Practice. I think the standards at the professions regulated by the Board of Medical Practice are a bit more standardized. And some of ours are very standardized as well. But we do have a few that I can think of that if you go state to state, the standards are different and the scope of practice is different.
Okay. Okay.
Okay, but then we have definition of healthcare services, definition of in good standing, meaning that someone holds an active license, certificate, or registration from another U.S. jurisdiction, that they're not subject to a disciplinary order that conditions, suspends, or otherwise restricts their practice in any other U.S. jurisdiction, and they're not affirmatively barred from practice in Vermont for any reason, including reasons of fraud or abuse, patient care, or public safety. So that's what it means to be licensed, certified, or registered in good standing. Mandatory disclosure is information that the healthcare professional must disclose to the patient at the initial telehealth visit or consultation as determined by the relevant regulatory body by rule. And you'll see as we go into the registration and licensure provisions that it speaks specifically to providing a copy of the mandatory disclosure if it will be required by that profession. Office is OPR. And then we get to the kind of telehealth specific definitions. So if you skip store and forward for a moment, you see telehealth is defined, and that is healthcare services delivered by telemedicine, store and forward, or audio only. So that's why we have the definition of store and forward, which is you may remember from some of our previous work, but it's the asynchronous transmission, so not in real time interaction of medical information, things like video clips, audio clips, images, x-rays, MRI scans, EKGs, EEGs, or lab results that are sent over a secure HIPAA-compliant connection to be reviewed at a later date by a healthcare provider who's at a distant site who's trained in the relevant specialty. And in store and forward, the healthcare provider at the distant site reviews the medical information without the patient present in real time, and then communicates a care plan or treatment recommendation back to the patient or the provider or both. So this is an existing definition from our insurance statutes where it requires health insurance coverage of store and forward and telemedicine. But I've put it in here as well so that it's easy to find for purposes of what is authorized.
So it's consistent.
Right. And then similarly, the definition of telemedicine is also taken from our insurance statutes. And that's the delivery of healthcare services such as diagnosis, consultation, or treatment through the use of live interactive audio and video over a secure HIPAA compliant connection. So store and forward is not real time, telemedicine is real time. And then audio only we have discussed in the past, but that's the scope of what is included in telehealth for purposes of this chapter. Then starting on page 5, we get to the licensure and registration requirements. So a healthcare professional who is not otherwise licensed, certified, or registered to practice in Vermont, but is licensed, certified, or registered in good standing, there's that term, in all other U.S. jurisdictions where they are or have been licensed, certified, or registered, and who wishes to provide healthcare services to a patient or client who is located in Vermont using telehealth, they must obtain a telehealth license or telehealth registration from OPR or the board. The telehealth license or registration authorizes the healthcare professional to provide services to a patient or client located in Vermont using telehealth only. Does not authorize them to open an office in Vermont or provide in-person healthcare services to patients or clients located in Vermont. So the scope of the telehealth license or registration is just telehealth. If somebody wanted to have more of a healthcare professional presence here, they would need to get a full license.
So, of course, I'm looking at this with an eye for loopholes. And,
Okay.
yeah, so
Great.
is there any place in the country where we might see someone coming from another country where the educational process is significantly different and the other state allows for some scope of practice that's not consistent with ours? Is there any way that someone can sneak through the cracks and practice with using telehealth that might, in our minds, put a patient in jeopardy? Have you thought that through? And I'm looking at Laura.
We have thought that through, and in part we thought that through when we were proposing the fast track endorsement that occurred 2 years ago, where if you're licensed in another state, even if the requirements are not substantially equivalent to our state and you've practiced there for 3 years, you can endorse into Vermont. I think some of the same principles apply for this analysis, and the way that we've handled that nuance, I go back a little bit to the naturopathic example, is we develop profession by profession policies with regard to fast track, but similarly we'll do that by rule for telehealth. And those, if there is the possibility of someone who's not appropriately trained being licensed in one state and that state's credentials being used in a way that might endanger Vermonters, I trust that we'll address that in rulemaking and try to remediate that with probably, I could see some requirement of showing education if we're concerned about that, or we could build up the qualifications for the telehealth license or telehealth registration if we had that concern. And I can see that in some professions more than others. A lot of our professions have a very standardized path, and the ability for that type of thing to occur is de minimis, but other professions have a much less standard path, maybe with no fault to their own. It's just not as fully a developed program. And we may need to set up some additional safeguards.
Okay, I know. The thing that comes to my mind, of course, is like conversion therapy, and that we don't allow in this state. And how can we? What are the guardrails we put around that happening?
So with conversion therapy, and that was of concern, and I think was discussed in the working group as an example of a provider not following Vermont standards. So there are Vermont standards. Obviously, the ban on conversion therapy is one of them. And we can build for mental health providers in particular, notice we could put it in the mandatory disclosure. We could put it in the that patients would sign that they understand that conversion therapy is not allowed in Vermont. We could put it in the rules for that profession. We could put it into the application itself. So there's multiple ways that we could address informing the provider that conversion therapy is against Vermont's standard of care. There's ways that we could inform the consumer that conversion therapy is against Vermont's standards of care. And of course, we would have enforcement action and capability if we found out that a mental health provider was providing conversion therapy via telehealth. We could go after that telehealth registration or license and revoke it.
Okay, thank you. Jessa has her hand up. And then Cheryl. Go ahead.
Thank you. And I apologize for doing this in this format, but since I have the ability to raise a loophole concern and when Senator Lyons just brought it up, I didn't really read it this way when they were working on the language in the House. But I'm wondering, and Jen and Lauren maybe can correct this, but I don't actually see the explicit language that you have to be licensed, certified, or registered in at least one other U.S. jurisdiction. The way it seems like you could read it to say you must be licensed, certified, registered in good standing in another U.S. jurisdiction in which you are licensed, certified, or registered. But I'm just thinking, again, the loophole scenario, what if you are licensed in Canada or Mexico? To me, it says if you are licensed in another U.S. jurisdiction, you have to be in good standing. I'm wondering if there's a way to make it even clearer. That you have to have a license in good standing in at least one other U.S. jurisdiction.
So I think that's actually baked into the definition of healthcare professional. The definition of healthcare professional is someone who holds a valid license, certificate, or registration in any other U.S. jurisdiction.
Perfect. Okay. Thank you.
Yes.
Great.
So otherwise, yes. So
Okay.
I think it's a good question, and that I believe is how we have addressed it.
Okay, good.
If I may, go ahead. Because I think this pertains to this in 3053, where it says in which the healthcare professional is or has been licensed. So if a person's license is expired, can they then apply for a license to do telehealth in Vermont?
No, because the definition of healthcare professional, which is the only people we're talking about here, are people who hold a valid license, certificate, or registration to provide healthcare services in any other U.S. jurisdiction. So if you don't meet that, then you do not qualify as a healthcare professional to start the rest of the conversation about your ability to get this
Okay,
license.
so what does that mean then in that section? Where
So this is really, to me, the reason it is or has been is the requirement that they were in good standing. So if they were not in good standing when their license lapsed in one state, that may be a reason that the board would not, or OPR, the board would not authorize them to get a telehealth license or registration here.
Okay.
So I see that as applying that retroactively or historical look at good standing. I don't know if Lauren has a different take.
Okay.
I was going to say the exact same thing.
Oh, good.
We just want to be able to look at everyone's disciplinary history from whenever they were licensed in any jurisdiction.
Okay.
Yeah,
Oh,
all
good.
right, that makes a lot of sense.
Okay, we're feeling good.
Yep, feel better.
All right. So I think we left off the walkthrough at 3053C. And this says that so in B, it was saying telehealth license or registration is only good for telehealth. Can't set up a practice in Vermont or provide services in person in Vermont with just the telehealth license or registration. And C says a healthcare professional who is not otherwise licensed, certified, or registered to practice in Vermont and provides healthcare services in Vermont using telehealth without a telehealth registration or license, or provide services that go beyond the limitations of their registration or license, is engaged in unauthorized practice and is subject to the penalties set forth in the respective provisions for OPR and Board of Medical Practice. So we're trying to kind of create this closed universe of what types of services can be provided, and with the telehealth license or registration, anything that happens outside of that is not okay. Section 3054 is the scope of the telehealth license and registration. So first, the telehealth license allows someone who is not a healthcare professional, so again, have to have that valid license somewhere else, who is not otherwise licensed, certified, or registered to practice in Vermont, can get a telehealth license to provide healthcare services using telehealth to a total of not more than 20 unique patients or clients located in Vermont during the 2-year license term. So with a telehealth license, it's 2 years, and you can see up to 20 different people, that's the unique patients or clients, during that 2-year period. To be eligible to obtain,
Okay,
yep, just pause.
help my little brain here. So 20 unique patients, so if one patient is cured within 2 weeks and you have another one, is that additive?
Yep, that's number 2.
All right.
So these are right. So it's not 20 patients at any time during the 2-year period. It's 20 patients, 20 different patients total.
Okay.
All right, to be eligible to obtain the telehealth license, a healthcare professional must complete an application in a format and with such content as prescribed by OPR or the board. They must hold an active, unencumbered license, certificate, or registration in good standing in any other U.S. jurisdiction to practice the healthcare profession that they are seeking to practice in Vermont using telehealth, and provide verification of the license, registration, or certificate to OPR or the board if required by the profession. If required by the rules adopted by OPR or the board, submit a copy of a mandatory disclosure that conforms to the requirements established by the rule. If required by the rules adopted by OPR or the board, provide documentation of professional liability coverage or financial responsibility that includes coverage or financial responsibility for services provided by telehealth to patients or clients not located in the healthcare professional's home state in an amount established by rule. So malpractice coverage.
So just on the liability insurance coverage. So the risk pool in Vermont may be different from the risk associated in California. So but the person is covered in California, not in Vermont. So I'm trying to understand the liability insurance issues that might be here.
Right, so what this is saying is they have to, if they're required to show that they have liability coverage, it must cover services that they provide to patients by telehealth, to patients or clients who are not located in California, that are located in Vermont.
Okay.
So it would have to be some kind of national coverage or something that specifically applies to telehealth provided outside their home state. Something that is broad enough if required by the rules, so it's going to depend on the profession, but broad enough to cover services provided to Vermonters by telehealth.
We're going to see a whole new insurance. No, we're going to see new insurance.
I don't know, and I don't know if
Yeah,
Jessa or Lauren has a sense for the scope of malpractice coverage that exists now, if that tends to be state by state
It's
or
too high.
national.
Other than that, so, yeah.
I don't know if it is currently, or if it tends to be state specific, or if it is.
Well, when a practitioner purchases, and Jessica can correct me if I'm wrong, liability insurance is based on the risk pool in state, but or does it go out of state? Jessica, can you answer that?
Sure. I don't know extensively. I will say of the malpractice companies that I've reached out to during COVID to answer this for Vermont physicians and other clinicians, typically those policies that are issued for Vermont providers do include telehealth coverage. However they do it with their actuaries, they factor that into the premiums that the professional is already paying it. Not to say that all malpractice carriers do that. We always tell people to confirm that with your malpractice carrier before you start telehealth practice. But at least for the major carriers that we have, that we're in conversations with for Vermont clinicians, it's tended to include that. I think it's really a growing area of interest, potential litigation. I think at this point, it's not considered a huge malpractice risk, but as that's probably also partly because the claims have been such a teeny piece of healthcare practice to date. But as that's grown, that may change, and I'm sure would be taken into account with premiums that the carriers charge.
Okay, so a lot of questions in here, so things are evolving, it sounds like, with this one, and that'll be interesting to see what rules are promulgated around it, and then also if you have a practitioner who is covered by an umbrella, I could see a clinic sending one person out to be the telehealth person. So anyway, this is interesting. Go ahead, Senator Hooker.
I just want to go back to the number of patients and stuff. You mentioned that if a provider wants to have more than 20 or more than 10 in their respective credentials, that they would then have to have a license in the state. Is there a path for someone to be strictly telehealth from out of state?
That's this.
This is,
how to be strictly telehealth.
yeah, but like a permanent, like have a license within the state so that they can have more than 20 patients or more than 10 patients.
That's the option then would just be the full licensure. So there is not an unlimited telehealth only.
If they had a full licensure in the state, they could practice strictly telehealth within the state of Vermont. Okay, thanks.
Lauren has her hand up.
I just wanted to add on the insurance piece that currently these professions do not have an insurance requirement in statute. So the contemplation of adding that by rule is specific to telehealth, in part to ensure that Vermonters are protected if something goes wrong. I'm not aware. The only professions that I'm aware of that have an insurance requirement are MMA and boxing, motor vehicle racing, and maybe home contractors. So, it's a very
outside the scope of the bill.
all of which are outside of the scope of the bill. Right?
They're doing both. They're not doing car racing by telehealth.
Thank goodness. But the intent of adding this was really to make sure that if something went wrong, that Vermonters would be protected, and contemplating that more of these providers would not be connected to a Vermont institution, which holds and carries liability insurance. So that was the rationale behind this requirement. I think it will be a very interesting conversation around which professions may decide to include this or may not decide to include this. I agree with the assessment that this is probably a growing provider, malpractice insurance coverage is ebbing and flowing around this area, and that litigation will grow. And then Senator Hooker, I just wanted to say that we do have one type of professional in the state that's a telehealth pharmacist. It's a particular type of pharmacist that only does telehealth. Otherwise, somebody would just need to get their full license in the state, and then they could do only telehealth if that's what they chose to do.
Okay, this is health. Go ahead, Senator Jones.
So you see a lot of commercials for men's health, parts of men's health. Would they, because their doctors are providing prescriptions for different things, and so they would have to also go through this process, I would assume, if this bill was enacted, right?
Yes, they would. They would either need to decide to dedicate one of those providers to all the Vermont patients and probably get a full Vermont license. Or they could have all of their providers have a telehealth license and each only see 20 Vermont patients. I suspect that they have more Vermont clientele than that would meet the needs of the telehealth registration. And the other important piece there is those drugs are being bottled, dispensed, and shipped into the state. So that pharmacy is also licensed in this state. So it's not only the provider, it's also the pharmacy that's doing the shipping to the home. So there's multiple licensed professionals involved in that type of medicine that's happening. And all of them are required to have a license of some sort, or soon to be a telehealth license or a telehealth registration in this state to treat a Vermonter. And that's why you'll see on some of these, Better Health is a good one. If you look on Better Health, they'll ask you which state you're in. And all of these providers have to ask you which state they're in. And there's some states where they are not eligible to provide services. It's because they don't have somebody licensed in your state, in Vermont. So there are some services that are advertised that cannot provide services here because they don't hold a license.
All right. Let's see, so on page 7, we're down to 2E. This is still for the telehealth license. The applicant must provide any other information and documentation of qualifications required by OPR or the board by rule, and pay the required telehealth licensure fee, which would be 75% of the renewal fee for the profession set out either in the OPR statutes in Title 3 or in the profession specific chapters in Title 26. And it allows a healthcare professional to renew a telehealth license every 2 years upon application and payment of the required fees. They can keep this telehealth license going every 2 years by reapplying and paying the fee. A license that has expired would be reinstated upon payment of the biennial renewal fee and the late renewal fee, which would be 75% of the applicable late renewal penalty. So that is the telehealth license. The telehealth registration allows a healthcare professional who is not otherwise licensed, certified, or registered to practice here to obtain a telehealth registration to provide services using telehealth for a period of not more than 120 consecutive days from the month the registration was issued, and to a total of not more than 10 unique patients or clients over the 120-day period that the registration is in effect. So the telehealth license is for 2 years and up to 20 patients. The telehealth registration is for 120 days and for a total of not more than 10 patients. To be eligible to obtain a telehealth registration, the healthcare professional must, again, complete an application in a format and with such content as prescribed by OPR or the board. They must hold an active, unencumbered license, certificate, or registration in good standing in any other U.S. jurisdiction to practice the profession that they are seeking to practice in Vermont using telehealth, and provide verification of that license, certificate, or registration to OPR if required by the profession. If required by the OPR or board rules, submit a copy of the mandatory disclosure that conforms to the requirements of the rule, and they must pay the required telehealth registration fee, which is the lesser of 50% of the renewal fee for that profession, or the application fee for a full license for the profession. So whatever's less, the cost to apply for a full license, or 50% of the renewal fee. And this makes more sense when you see Lauren has information on what the various fee, application and renewal fees are. That may help, although that may be a finance issue.
Yeah. Well, this will probably have to scoot down to finance, or at least maybe you could look at it while it's up on the floor or something like that. It's up to you.
For the telehealth registration, the healthcare professional can only get a new or have a telehealth registration once every 3 years. Unlike the telehealth license that they can keep renewing every 2 years, this is 120 days of registration in a 3-year period.
What page are we on?
We are on page 9. And a telehealth registration shall not be renewed or reactivated upon expiration. So you can't go from a 120-day period to another one, you have to wait 3 years. So I will pause there in case, because we're about to look at some other things around licensure and registration. If you have any questions about the difference between the two or any of the provisions in those that you want to ask me or your witnesses.
No, I think it would be helpful to just see what the fee schedule looks like, and then that's something that finance will have to deal with. And then my question is the $300,000 currently in the budget?
The 360,000 a year?
Whatever, yes, in the fiscal note.
I believe so, but
Okay,
I would have to check.
so this bill has a pathway. Lauren, go ahead.
I think that there was a drafting error. It's in the budget. My understanding, and if Nolan hears this and wants to correct it, that'd be great. But my understanding is House Appropriations have put it in their line by line budget, meaning it's accounted for, but it's not in the big bill. And it needs to be added into the big bill.
Oh, that'll be fun. Okay.
Yeah.
I was not, I'll follow up with JFO on that.
Yeah.
Okay,
that's-
thank you. Yeah,
Yeah,
it's a
who
new
will-
wrinkle for me, so I appreciate any help.
Our goal here is policy, and we want to be able to recommend it, and then both finance and approach will have to look at it. I know.
Right,
one
and it
has-
may just be that appropriations, if it's
Right,
getting carried in the budget, appropriations may just need to
Check
strike
it
that
over.
section.
yeah,
If it's not necessary in here, or they may just need to account for it and let it continue to ride in here.
okay.
I have a
Go ahead.
question. I'm just curious to know with regard to the registration for, 10 patients for 120 days and you can't renew but every 3 years. Do you have examples of what would prompt that?
Sure, I'll give an example. I'm a mental health treatment provider. I've been seeing an 18-year-old for the last 3 years. She's coming to UVM to go to school. And we've decided that she needs a provider that she can see in person and not via telehealth, but it's hard to find a mental health treatment provider right now. So I want to see her for a transition period as she's finding a provider located in Vermont. I think that's a classic example.
Just thinking, then what does she do if she, the 120 days lapses, that provider can't re-up for 3 years?
So that provider would
That
switch.
provider, but that would be.
Would switch to the telehealth license.
Yeah.
They figure out that telehealth works, or the student can't find a provider, they would switch to the telehealth license. And that fee would be the amount that they paid towards the telehealth license. The telehealth registration could go towards the telehealth license or full license.
Okay. All right,
What-
thanks.
So what I'm gonna suggest is we finish transition to license and then end when we get to page 10 on the scope of practice. Because we've got to let interpreters in for the next.
Oh, right, okay. Okay, so subsection C on page 9 is other license or registration. So this is just specifying what we've been talking about. If someone, healthcare professional who wants to provide healthcare services to a patient or client located in Vermont using telehealth may register or apply for a full license to practice the profession in this state in accordance with the applicable provisions of this title. So nothing in this section it should be construed to prohibit a qualified healthcare professional from registering or obtaining a full license to practice in Vermont. It's just meant to be another option. And transition to licensure, if someone, and this is goes to the example that Lauren was just giving, if a healthcare professional holding a telehealth registration elects to apply for a telehealth license or full license while their telehealth registration is in effect, or within 3 years following the effective date of their telehealth registration, then the amount of the fee paid by that healthcare professional for their telehealth registration will be credited and applied toward the amount of the relevant telehealth license or full license, depending on what they're going for. And if a healthcare professional who has a telehealth license chooses to apply for a full license while their telehealth license is in effect, then the amount that they paid for the telehealth license will be credited and applied for the amount of the application fee for a full license. So that's kind of how you can get that fee credit for licensing.
Yeah. Okay, all right, good. This is helpful. So we'll have to come back to this, and we would invite you all to be here with us when we finish the discussion and markup. But I think we're making some progress. We'll start right here on page 10 with scope of practice. So we'll put it on hold for now. We'll try to find a place ASAP to complete the work on the bill. So thank you very much.
Thank
And we're
you.
gonna go
Thank you.
off to